Good afternoon. Welcome to Life Unrehearsed. My name is Matt Delvecchio, specializing in life transitions, downsizing in the senior living industry. Thought we'd start you off with a great rendition of Stairway to Heaven, performed by Heart. Love that song, and especially that particular version. For some of the new listeners, Life Unrehearsed used to be on Saturdays at 3 p.m., and as of last week, it is now on Sundays at 4 p.m. And for the longtime loyal listeners, you may remember that Life Unrehearsed originally started 6 years ago at the same date and time. So we're coming full circle here after a couple of years on Saturdays, and thanks for tuning in. Coming up on the show, Dying with Dignity, the growing popularity of medical assistance in dying, otherwise known as MAiD. And we're going to discuss many aspects of MAiD, including the controversial medically assisted death law to cover those suffering solely from a mental illness. And on the second half, we're going to be getting helpful words of advice for adult children, also known as the sandwich generation, regarding elder care planning and support, and that's just after the 4:30 news. How about this gorgeous weekend? I don't know, there's something about the clocks advancing an hour. I was downtown today. In fact, it was a proud dad moment. My son is graduating from the McGill Mechanical Engineering program, and today was the Iron Ring ceremony, if you know the history behind that, but they get their iron ring. So really proud, and we did a celebratory smoked meat sandwich on St. Catherine Street. And I'm telling you, St. Catherine's was packed. There was people walking around, just this overall vibe. A lot of bags full of goodies. The retailers must be happy. So spring's around the corner. And just take a look outside. The sun isn't even close to be setting. In fact, it's going to set at 6:57 p.m. today. So, all right, Montrealers are ready to bring it on. Spring is around the corner. Now, I work, for those of you who know me, I work a lot with seniors and adult children, and I'm hearing more and more people saying kind of phrases like, you know what, I want to die on my terms, or there's no way I want to leave this earth like my dad or mom or grandparent. Maybe they saw this and it was a very traumatic experience. And we're getting a lot of inquiries about medical assistance in dying and what's commonly known as MAiD, as I've mentioned before. And what used to be a taboo subject is becoming more and more popular. And perhaps more importantly, it's becoming more acceptable in our society. Well, let's learn more about this hot topic, and I wanted to bring in Dr. Benjamin Schiff. Dr. Schiff is an MD and assistant professor at McGill University in the Department of Family Medicine. He has been a MAiD assessor and provider since 2016 and is a member of the MAiD Resource Group College of Family Physicians of Canada, as well as the Canadian MAiD Curriculum Development Committee. Dr. Schiff is a full-time family physician working at St. Mary's Hospital in Montreal, and most of his time is spent as a hospitalist, including working in oncology. He has a lifelong interest in medical ethics, and especially around the end-of-life care. Dr. Schiff, welcome to Life Unrehearsed.
Thank you very much for having me. Pleasure to be here.
I'm glad you are here with us, and thank you for taking some time. Maybe we need to back up a little bit here, Dr. Schiff. Can you just explain what exactly is medical assistance in dying?
So essentially, it's when an adult makes a request to have someone, a health professional, a physician, or in the rest of Canada, a nurse practitioner, help them die sooner than they would otherwise be doing naturally. And so the physician or nurse practitioner either prescribes a medication or more commonly administers a medication that results in that patient passing away.
And as I mentioned before, it seems to be getting more accepted in society. It is getting popular. Can you provide us with some of the actual statistics about the number of Canadians that are choosing medical assistance in dying?
It's been about, the latest numbers were published. The Canadian government, through input from all the provinces, keeps track of these things. So there's been about, give or take, 30,000 people who received medical aid in dying since it became legal in 2016, and about 10,000 in 2021, where we have the latest statistics. And that accounts for about 3 to 3.1% of all deaths in Canada.
Wow, actually, I'm quite surprised that that number already at 3% and growing out as a percentage-wise on an annual basis. So let's get into the actual process. How does one go about getting medical assistance in dying, Dr. Schiff?
So you can make a request. Essentially, it has to be a written request. You can certainly speak to any healthcare professional or physician to get some information, but ultimately it requires completing a medical form. There's different forms in different provinces. Quebec has a specific form. And once that form is completed, then either the physician who you made the request to can help, or that's passed on to a group or a team, and these teams are sort of available throughout Quebec and based on the various CISs or CISs, which are the sort of local health networks. And they have identified in each of those regions physicians that are willing and able to participate, and they would be then informed of somebody who's made a request. And from there, the physician will make an initial assessment to determine whether that person will be eligible under the law. And there's a number of steps afterwards, which I'm happy to expand on. But that's the basic step. So a request is made. It's a written request, and then a formal assessment would be done by somebody with experience to determine whether that person is eligible to receive medical aid in dying.
You're listening to Life Unrehearsed, Matt Delvecchio, and we're talking with Dr. Benjamin Schiff about medical assistance in dying. And you mentioned, Doctor, certain conditions need to be met. I get asked this question a lot. It's one thing to say it, but it's one thing to actually make the request. And I often get asked, what conditions need to be in place to qualify for MAiD?
So primarily you have to have access to legal health care in Canada or a province that you're in. You have to be 18 years old or over, and you have to be suffering from what's called a grievous and irremediable medical condition, which essentially is a serious illness, disease, or disability, although in Quebec it's not officially a disability, but a serious illness or disease. You have to be in an advanced state of irreversible decline, so you have to be, unfortunately, deteriorating from whatever condition that you have. And you have to be suffering, and that suffering can't be relieved or isn't able to be relieved in a way that is acceptable to that person. You also have to be doing this voluntarily, so not under coercion or pressure for whatever reasons. And you have to be able to be competent to make that type of request. So those are essentially the conditions. But most importantly, it's about the type of condition. So it's not a specific disease, but it's more related to the type of condition that's serious and the state that you're in and the suffering that you're experiencing, whether it's physical or psychological. It doesn't have to be a physical suffering to be considered eligible to receive medical assistance in dying.
And we're going to talk a little bit later on, a little more sensitive topic about mental illness. Right now you're saying physical and psychological, and I know there's been heated debate about the mental illness aspect. We're going to talk about that soon, but I'd love to find out, who is asking for MAiD? Do they break it down into categories, Dr. Schiff, and who's asking for MAiD?
So most of it is still patients with cancer, and that's certainly been my experience. It's a little bit more in men than in women, and it tends to fit in this older age group, so 50 to 80, if you will, in that sort of range, or 55 to 80. But it's still, for now, the majority of people who make that request are suffering from some form of cancer. And
besides cancer, what other types of conditions would be there?
So certainly other conditions like neurological conditions or advancing memory issues, Parkinson's, other types of conditions like ALS or MS, anything that have a neurological component to it as well. That's certainly becoming more and more frequent, and that's sort of one of the original driving forces behind this case. And if anybody remembers way back when Sue Ann Rodriguez, who was the first person to bring this forward many years ago, she was suffering from a neurological condition. So it sort of started from that many years ago. But essentially, the broader categories are going to be people with cancer or people with what I call degenerative neurological conditions, again, like ALS, MS, Parkinson's, and Alzheimer's as well, or dementia.
Talking with Dr. Benjamin Schiff about medical assistance in dying here on Life Unrehearsed. I'd like to ask a quick question before we head out to traffic concerning what the event itself looks like. Can you describe that? If you're in a room, what happens?
Sure. So essentially, there's a lot. As you can imagine, it's not a decision that's made lightly or quickly, and there's a whole process involved whereby the physician will meet with the individual, maybe with the family or friends, depending on what the patient would like. But ultimately, what will be involved is a kit that has actually been set up because Quebec was a little bit different than the rest of Canada, in that because it was set up initially because the government, in consultation with the public, had organized this. So even the medications were already set up in advance. So you have a pharmacist that prepares a kit. You meet with the pharmacist and the person who may be helping you, which is usually a nurse. And you go through, in that kit, there's the various medications that would be used. Prior to that, ideally, somebody's been able to place an intravenous or needle in the patient's arm so that you can provide the medication. And you walk into the room, and depending on the circumstance, it could be at a home, could be in a hospital. And there may be just the patient in the room. Sometimes there may be family, friends. It's really up to the individual. Because as you said at the beginning, this is really the individual being able to determine for themselves how they want to say goodbye and how they want to end their life. And so they can decide if they want music, flowers. I've had many different instances where there's been at one point 12 or 14 people in the room. Because it's really up to that person. Mm-hmm. And then you sit down with that person and whoever else wants to be in the room on the bed, and you begin by explaining to, again, because you've explained previously, what you're about to do. And as is always the case, the person has the opportunity, even at the last moment, to make sure that they still wish to continue with or to change their mind. And if they still do wish to continue, then there's a series of medications that you provide. And the whole process may take actually about 10 to 15 minutes on most circumstances.
All right, we're going to continue our conversation with Dr. Benjamin Schiff, and our medical assistants in dying. Very emotional, but also, I think, Dr. Schiff, we're going to talk about some of the reactions from families, and we're going to address the very sensitive topic about mental illness. But first, we have to head out to the CJD Traffic Center, and let's hear from Marty Lamar. Welcome back to Life Unrehearsed. My name is Matt Delvecchio, and we're talking with Dr. Benjamin Schiff about medical assistance in dying, or MAiD as it's commonly known. And Dr. Schiff has been a MAiD assessor and provider since 2016. And this subject is a difficult subject for some, but it is about dying with dignity on your terms. And we just heard about the actual process from Dr. Schiff. And Dr. Schiff, I'd like to find out about some of the reactions from family members and their loved ones during this process and even after the process.
So it's a privilege to be a part of this and to share this with a family. It's very interesting because, more often than not, when somebody passes away, there's sadness. And of course, there's always sadness when this happens. But I think there's a sense of relief. There's a sense of celebration. There's a sense of being able to be there at the moment, not getting a phone call in the middle of the night that somebody's passed away. You get to spend those last moments and planning for those last moments. And it's interesting, too, because you become part of that process, become, in some ways, part of that group and that family if you've gotten to know them. And in almost all circumstances that I've been involved with, families end up being very grateful to all that are involved, which is always, again, something ironic or interesting that here it is somebody you've helped their loved one pass away, and yet they're grateful to you and to the team that was able to respect the request and allow their loved one to pass with dignity on their own terms the way they want to. So it's tearful, it's emotional. It really does affect you, and it should never stop affecting you. And as a physician, it's always a very emotional moment, but it's also as I said, a privilege to be able to share that moment with family who are almost always grateful to see their loved one pass in a peaceful way.
Yeah, I could imagine. I'm on the board of Nova West Island, and we've got a team of nurses and very much involved in palliative care as well. And the human factor, like you say, for the physicians, it's hard to remove yourself from that. But you said a very interesting word that you hear a lot from families, grateful. And it is kind of ironic, but I would imagine also for a loved one that's been suffering perhaps for a long time, this is an end. But like you mentioned, families are grateful for what you are able to do.
Absolutely.
I want to address a very hot topic. As many of us are aware, the federal government recently delayed by 1 year the expansion of the medically assisted death law to cover those suffering solely from a mental illness. So I think there's some confusion, Dr. Schiff, about the term mental illness. So can you give some examples of what would be considered mental illness, and therefore MAiD has been delayed due to this types of mental illness?
So just to clarify so that everyone understands, it's not that if you have a mental illness that you're excluded from receiving MAiD. It's if you're requesting MAiD because of the mental illness being the reason. So somebody who has schizophrenia, somebody who has depression, somebody who has obsessive compulsive disorder, and also happen to have cancer or Parkinson's or another condition are absolutely eligible if they are deemed to satisfy other criteria. The issue is more that if the reason that you're making that request is specifically because of your mental illness, and as I said, things like depression, things like obsessive compulsive disorders, personality disorders, those are the types of illnesses where people, particularly I would say depression, where people have the most suffering over and may suffer for many years if their depression is not able to be treated in a way that allows them to enjoy life the way they want to.
And where does dementia come into play, Dr. Schiff, on this? If you've got someone with dementia, Alzheimer's being one of the, as part of the dementia umbrella, popular disease, from what I understand right now, this would not be considered a reason for MAiD.
Well, in fact, that's not necessarily true, because somebody who is in the process of going through dementia and is expecting a decline in the future can certainly make a request in the sense that because dementia is more than just a mental illness, because dementia incorporates, and as we all know, dementia, unfortunately, is a disease that has no cure, and many patients with dementia, particularly as they advance, are in this advanced state of irreversible decline and are suffering at the moment, and are also suffering because of what they anticipate will continue to happen with them. And so dementia is a little bit different than some of the other illnesses, and certainly patients would be eligible. And in fact, there's some suggestions, both in Quebec and in Canada, that governments are looking at potentially putting in the possibility of an advanced request so that if you're diagnosed with dementia, you may even be able to make a request that in the future, when you're no longer competent and able to explain or understand what's happening, you may still be eligible to receive MAiD. So dementia is a little bit different than other mental illnesses, only, again, because of the fact that there's other components to dementia more than just simply the mental illness itself. And dementia is not just a decline in mental faculties, but a global decline in your ability to function. And so it fits a little bit differently and does fit with the laws that currently exist.
You're listening to Life Unrehearsed. That's Dr. Benjamin Schiff talking to us about medical assistance in dying. Very interesting how this is developing, Dr. Schiff. And could you imagine that you may even be able to put in a request even prior to a disease like dementia advancing? I guess, there's pros and cons about this delay of about a year. What are your thoughts about the delay?
Personally, I'm in favor of it. I think that, I know not everyone is, and the pros and cons are essentially that, there are people out there that are suffering that will not have access to this, but mental illness is unique in the sense that the disease itself may impact one's ability to think clearly and rationally about your process, just because of the fact that by definition, some of these mental illnesses like depression do affect your ability to process information and be able to make sense of things. And so I think what we really want to make sure is that there are adequate safeguards. And that's, I think, the big issue that's come up. And from the moment the law came in, there were always safeguards in place to try to ensure that the patients who make the request, all the conditions are satisfied. And mental illness in particular, and as I think most people know, access to services for people who are suffering from that illness is certainly not up to the way we would like it. And so we want to make sure that if it does come to the point where somebody is making that request, then in fact they've had the opportunity to receive whatever care and support they might have wanted before having to make that decision. So I understand this is controversial, and I understand that for some people who are suffering with mental illness, it may mean that they have to suffer longer, and these are not easy choices to make. But ultimately, it's a balance between trying to support individuals who wish for something and the wish to protect those most vulnerable in society, and certainly those suffering from mental illness qualify under that. So I think it's a reasonable balance. I am aware personally of committees that are working very diligently to try to come up with these safeguards and approaches that will be protective of those that are vulnerable, but recognize that there will be circumstances where people do suffer, and there is no other type of cure other than alleviating their suffering with helping them pass away. But I think we need a bit more time to make sure it's done right.
Well, I think you'll have a lot of people in your court on that point of view, where it is very sensitive. They want to get it right. You've got the other train of thought. Hey, you've got to let's move it forward. Otherwise, we could analysis paralysis and debate this forever. But this is such a sensitive topic. It is moving in the right direction. And Dr. Schiff, you have been a leader. I know you work with a lot of colleagues right across the country, and as a Montrealer, as a Quebecer, they tend to be on the forefront of this subject. So I just want to thank you for all the work that you do, and I want to thank you for joining us here on Life Unrehearsed.
It's been a pleasure. Thank you for having me, and thank you again.
All right, thank you. That's Dr. Benjamin Schiff. He's a family physician working at St. Mary's Hospital, and he's been a MAiD assessor and provider since 2016 and is a member of the MAiD Resource Group College of Family Physicians of Canada, as well as the Canadian MAiD Curriculum Development Committee. This is obviously a topic that will continue to evolve, but I think dying with dignity is what people are asking for and the population is asking for, and it's going to be a generational shift. Next up on Life Unrehearsed, are you worried about your parents going through their aging process? Well, we're going to be getting helpful words of advice to adult children, also known as the sandwich generation, regarding elder care planning and support. That's going to be coming up after the CTV News Update.